telling you that that branch, either there's something going on, or the pressure is inadequate in some way so that it actually, supplying where it's closest. You know, the example will be, think of it as like people with a lot of radiators in the house. You have multi-room, multi-floor. Like the higher floor tends to get less heat, or the radiator that's furthest away from your furnace tends to get less heat for that same reason. Okay, so, but normally you're not supposed to be. So maybe tiny bit of differences, I mean, that's normal, okay? So in your case, you look like you're a healthy gentleman, so I don't anticipate there's a big difference. I mean, so I don't know what your normal pressure, you don't have to tell me, and let's see if we can find out.
All right.
Okay, so would you like to listen?
Sure.
You can. All right. The other part that very often when we first learning how to do this is to confuse, which side do we put this on? So
I'll picture
a lot of the nice cuff actually give you a kind of a point to say where to line up. Right, so they say this side against the limb. And it tells you where you mark your artery. So if you really, really want to be careful, just read, okay? And then all you just remember, okay, all these pictures on the outside. So that's the easy part. So you already have a sense of where the artery, right? So think about right around this region. And since this is pretty wide, so chances are you don't have to be like, it's not like when you're palpating, you have one finger, two finger. So it's gonna be right about this area. Most of the time it's pretty much spot on, okay? But if you really wanna be absolutely careful, you can of course manually palpate, and then that's where you're gonna place this. So we're gonna put this first slightly above that, so usually across the bicep. And so we kind of line up, where the, and also you wanna make sure that this thing is totally deflated, so let me get this. All right, all the air's gone. And just, you want to make it nice and completely wrap around, but doesn't have to be super tight, because obviously you're going to be tightening it as you go. Now some of these portable unit, actually the dial, it's just a freestanding dial. They usually just clip it right here so you can see. So that's what this cuff is designed to do. So in case you wonder why there's a strap here. All right, so you have this now covering up. And this, I put it right about there. And sometimes if I don't have an extra hand, I can kind of slip it under, it sits in place, kind of a little, kind of cheaty, way to kind of have an extra pair of hands to hold it for me, so that I don't have to touch this if I don't have to. But of course, it's better if you're gonna hold it in place. But I also find that if you put your hand here and you jitter around, you actually create a lot of sound. That you kind of, it's like, what am I hearing? So that's why sometimes it is better off not touching. One less thing to kind of create any kind of distraction. Then you just have to make sure, this is gonna be in place and still on the same spot. So let's see, we're gonna leave it here for now, and let's see what we got. Oh, one thing about this, make sure they are pointing forward when you have this. So you have it back.
Yeah. There we go.
Why is it different? Think about your auditory canal in your ear. Always go with anatomy, right? The ear, actually the tube goes in and it goes forward this way. So if you turn it back this way, you're actually blocking. You're not pointing this directly to your canal. This is directly pointing at your eardrum. So you hear differently when it's pointing forward.
Yeah, it's clearer.
So it's another thing. So a couple of things that especially during practical, you know, you're already gonna get nervous. You don't hear anything. So especially if I saw you got it reversed, then I know you're not, I know whatever number you give me is not gonna be accurate. Hearing? All right, so let's just check. Pretty loud, eh?
Yeah.
So don't bang on it. Versus here, right,
Yeah.
not much.
Mm-hmm.
This is not.
Yeah.
So we know we're on the right spot. So we're right here. And now we're going to slowly, let me move it here so I don't have to twist my neck too much. Make sure this is tight this way, right? I'm holding it like so. Alright, so initially to put obviously 20, I'm pretty sure I'm still getting a good pulse. So if you put a check pulse here, then obviously this is gonna be in place, you don't have the third set of hand. So if you're over here, you hear beeps?
Yeah. I think it's like 121 over like 68 or something. Or...
Okay, close enough. Alright, so it's about 120 over 66, that's what I got, so, well, be able to take a couple of beats here and there. So, as you can see visually, even you guys without listening, you can see when it gets to the point, it's starting to jump. And you can eventually diminish, so of course the sound will be far more accurate than the visual. Right, so you do need to listen, and you can hear, and you probably can feel like at a certain point your pulse is diminishing, and it gets to the point where about really right about this region where I don't feel anything. So that's why then I don't go over 140. And so his pressure, it's pretty normal. Okay, and the rhythm is steady. So sometime when you're doing BP, even that, if you hear that beep is erratic or sometime loud, sometime low, and just any irregularity, it's also telling us that you know, may need to look at it a little more specifically. So just for the sake of, you know, learning, let's see if we can try it on the other side to see whether or not there's a difference. So this time I'm not going to palpate, I'm just going to see if I can just go along with listening. Ready? It's just much calmer now.
Yeah, that's what it is.
First time he was a little excited. So it's a tick. I mean, not
Yeah.
not really. You know, this
120
is
over 60.
right about there, and it's probably like I would give it 60. 62 or so. So slight variation, not really ridiculous. So I don't think there's an issue here. I hope that you did not have any prior history here.
Nope.
So questions? What do you think? All right. How many of you have never done this? You never tried this?
No, you said have or
Have not.
Oh,
Have
have
not.
not. Oh.
Okay. All right. So who wants to give it a try? You want to come here and take my seat? Can I use you? Can I use you, or can we have somebody else? I mean, it doesn't have to be you.
That's fine.
All right. Let's have at least one person try this. Who wants to grab this?
Not all at once.
Somebody. Nobody wants to do this?
Don't bite.
Really? It's okay. Look. I mean, sooner or later, if it's not today, you're gonna have to do it on Wednesday.
I'll try.
Yeah, you're only getting more practice.
Yeah, come on. It's always nice you have an audience.
And you have the range already. You know, it's around 120 over 60.
Oh, on that note, let's change the body on it. Let's put another person.
Dr. Joe.
Yeah, switch.
You want to switch?
Yeah, you try.
Wait, what?
Yeah, switch. You take mine. Since you already get it. I want to see you do it again.
No, you can keep it on if you're checking. You're using the same one. So you want him to check your pressure, you say?
Yeah.
Okay.
Oh.
I want to see you do it. Somebody one more time.
And he just want his pressure checked. Free blood pressure screening.
Yeah. Roll up your sleeve.
See, whenever possible, I do like to sit across the table of the person, so that the arm is nicely positioned and I can have a good reach and good positioning of the unit.
Relax.
It's not leaking.
You got 120 over 80. Is that what you heard?
Like 82. Yeah, 82.
Okay. All right.
Alright, is that next?
Questions? All right. So that's what I want everybody to get really good at this. Okay?
I'm hearing him breathing really hard right now.
What you need is,
That's what I didn't even know. What that was.
Wednesday, your goal is
You
to
heard it,
check
Yeah.
everybody's pressure. Keep rotating,
It's like speed dating.
right? Speed dating for 5 minutes, or, not even 5 minutes, it takes less than that.
Is the first number that you get when you start hearing it,
Mhm.
and the second number is when it stops?
Yeah,
Right.
so it's
Last
like,
number
nothing,
before
nothing,
fades.
nothing, boop, boop,
So you hear
boop,
love,
boop,
and you hear
boop. And then eventually it's gone, and whatever that first, that last. Sometime you might get that initial boom, and then it didn't show up for a little while. And that's why I don't wanna go too fast, because, you know, you might miss that first bit. Okay? So that's what's in store. Also, then Wednesday, obviously, we are going to work on also learning to listen. I mean, you know, you heard the video talk about different murmur sound. Depends, I mean, maybe none of you have any heart murmurs, so you're not gonna hear it. But if any of you ask you same thing, I want you to go around, not only checking pressure, you're gonna go around listening to everybody's heart sound in those 5 positions, okay? And maybe you guys pick out something, you know? I'm not telling you, you know, because I don't know, I haven't listened to any of you. So, but that's also what we're gonna be practicing. So one thing very important for Wednesday when we come for lab, you need to dress appropriately, okay? We don't want anybody to have to expose themselves unnecessarily. So you have your tank top, your t-shirt on, all right? You keep it on. You can palpate it, but you cannot listen over clothing. So the diaphragm has to be against skin. So for female, you know, have halter tap, and so that you can still listen over, no, you're not gonna be putting over the material. So you can still at least put in the position where you can access those areas. Okay? Does that make sense? So please come prepared. Again, you know, your bathing suit or halter top, that will do. And even for the gentlemen, if you come in with a tank top. So that way we don't have to, you know, nobody should be, you know, being exposed unnecessarily. Okay, but we do need to learn to identify the regions. Remember the second rib, intercostal, third, parasternal, and then the fifth, the apex region, mid-curricular. Okay, so kind of, you know, you're probably gonna have to eyeball it somewhat, because it's not like you need to take out a ruler to measure the entire length of the clavicle and then divide it in half and then measure this. It's kind of your eyeball. You kind of have a sense of where acromion, sternum, right? So that's right here. So halfway point, you have an idea where that is. And then just a straight line to the fifth intercostal. Okay. And how do you palpate the intercostal? You're on the sternum, right? You know your sternal notch is your 1, and kind of boom, 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 boom. So that's where your palpation skill comes in. All right, so right along so next couple of days, feel it out on yourself.
On the train.
You know, stop. Don't go on the train. You're gonna look at you like, oh, what's this guy doing?
Probably not the worst thing.
So, oh, you see worse.
Oh.
Yeah.
So yeah, so at home when you know by yourself, you know, in the shower, whatever, you know, in front of the mirror, stop. You need to identify all these things we're doing, right? You need to be able to identify it on yourself, and that way it makes it easier. Then you should be able to identify on any patients. All right. So that's what we'll do. All right. Questions? All right. All right. Before you guys disappear, let's go back. Let's look at those questions.